So now we'll discuss about respiratory system. So the anatomy and physiology of the respiratory system. Functions of respiratory system, that is air distributor, gas exchange, filters, warms and humidifies air, influences speech, allows for sense of smell. So the divisions of the respiratory system are upper respiratory tract, that is outside thorax, nose, nasal activity, sinuses. So here is the diagram we can see here. So here we can see the sinus, nostril, tongue, larynx, trachea. So superior and middle inferior nasal passages. So next is the pharynx and larynx. So divisions of the respiratory system is lower respiratory tract, that is within the thorax, that is trachea, bronchial tree, lungs comes. So the structure of the upper respiratory tract here, nose, that is warms and moistures air. Septum separates right and left nostrils. So here we can see the palatine bone that separates the nasal cavity from the mouth, and cleft plate, that is a palatine bone, does not form correctly, difficulty in swallowing and speaking. So here in the diagram we can see all the parts. And in septum, that is rich in blood supply, that is the nose bleeds. Sinuses, that is air containing spaces, so open or drain into the nose, lowers the weight of the skull. So you can see here the diagram. Next is the pharynx, that is throat. So base of the skull to esophagus, and it has three divisions, that is nasopharynx, that is behind nose to soft palate. Adenoids swell and block, or oropharynx, that is behind mouth, that is soft palate to hyoid bone, that is tonsils. Next is the laryngopharynx, that is hyoid bone to esophagus. So you can see in the diagram. And next is the that is changes the shape to allow for vowel sounds, that is phonation. And larynx, that is voice box, root of the tongue to the upper end of the trachea. So you can see here in the diagram clearly about the tongue to upper end of trachea, made of cartilage and two pair of folds, that is vestibular, that is false vocal cords, and true vocal cords. Next is the thyroid cartilage, that is Adam's apple, larger in males due to testosterone. Epiglottis, that is flap of skin on trachea that moves when swallowing and speaking. Closes of trachea when swallowing food. And trachea is wind pipe, that is larynx to bronchi, consists of smooth cartilage and C-shaped rings of cartilage. Tracheostomy, that is cutting of an opening in trachea to allow breathing. Next is the bronchi, that is tubes that branch off trachea and enter into the lungs. And silated, it is silated. Why? Means the branches is primary, bronchi is secondary, bronchi is tertiary, and bronchi is broncholis. So broncholis branches into microscopic alveolar ducts, and which terminates into the alveolar sacs. So you can see clearly in the diagram about bronchi. And here is the diagram about the main reproduction, that is alveolar sacs, alveoli, alveolar duct, smooth muscles, pulmonary vein, respiratory bronchi. Next is the lungs. Lungs is the extended from diaphragm to clavicles, divided into the lobes by fissures. So visceral pleura adheres to the lungs. So here is the diagram you can see, there is larynx, hard plate, nostril, bronchus, trachea, pharynx, soft palate. So the broncholis are given in the diagram, that is bronchi, left lung and right lung. So the specific clear diagram is given here. Next is the respiratory physiology, that is pulmonary ventilation is breathing, that is mechanism is movement of gases through the pressure gradient, that is high to low. So when atmospheric pressure is 760 mmHg is greater than the lung pressure, the air flows in, that is inspiration. So when lung pressure is greater than atmospheric pressure, the air flows out, that is expiration. So pressure gradients are established by changes in the thoracic cavity. It increases the size in thorax and a decrease in pressure and the air moves in. So the decreases size in thorax, increases in pressure and the air moves out. So this is the breathing in and breathing out specific diagram. You can see here inspiration, that is contraction of diaphragm and intercostal muscles. Expiration means relaxation of diaphragm and intercostal muscles. So volume of air exchange, that is tidal volume, amount of air is exhaled normally after a typical inspiration. So expiratory reserve volume means additional amount of air that is forcibly expired after tidal expiration. Then inspiratory reserve volume means amount of air that can be forcibly inhaled over and above normal. Residual volume means the amount of air that stays trapped in the alveoli. So volume of air exchange, here vital capacity, that is the larger volume of air the individual can move in and out of the lungs. The vital capacity is sum of IRV, TV and ERV, which depends on many factors, that is size of thoracic air cavity, posture, volume of blood in lungs, that is congestive heart failure, diseases, etc. Volume of air exchange. So here the normal quiet breathing is about 12 to 17 breaths per minute. Hyperphagia means increase in breathing to meet an increased demand by body for oxygen. So here are some hyperventilation means increase in pulmonary ventilation. So these are all about the respiratory system. Thank you.